Your cat seems healthy, calm, going about their usual routine. But what you might not realize is that behind this seemingly normal behavior, one of the most common and dangerous diseases affecting adult cats could be silently developing: kidney disease. And the scariest part? It's silent. By the time the first signs show up, it's often already too late. Chronic kidney disease affects millions of cats around the world, especially older ones, and it can go unnoticed for months or even years. Meanwhile, the kidneys gradually lose their ability to filter the blood, and your cat's body slowly starts to become poisoned from the inside. But there are signs, small behaviors, and subtle changes in daily life that can indicate something's wrong. And if you know how to spot them in time, you can literally save your best friend's life. In this video, we're going to show you exactly what to look for. We'll talk about the most common symptoms, the tests that confirm the diagnosis, and most importantly, what you can do to care for your cat with love, responsibility, and the right information. Stick with us until the end, because what you'll learn here could make all the difference between a silent disease and a long, healthy life by your pet's side. And don't forget to subscribe to the channel. It helps us keep bringing you more information to care for your furry friends. What is kidney disease? Have you ever stopped to think about how important your cat's kidneys are for their health? These two small organs, located toward the back of the abdomen, play a vital role. They filter the blood, remove toxins, and help balance water and mineral levels in the body. When the kidneys stop working properly, your cat's body starts to accumulate substances that should be eliminated through urine. And that's when the problems begin. Kidney disease in cats can show up in two main forms. The most common is chronic kidney disease, which develops slowly and progressively, usually in older cats. It can go unnoticed for a long time because symptoms only appear when a significant portion of kidney function has already been lost. That's why it's known as a silent disease. Acute kidney failure, on the other hand, happens suddenly and is usually caused by things like ingesting toxic substances, severe infections, or even urinary blockages. In this case, symptoms appear quickly and require immediate veterinary attention. No matter the type, kidney disease is a serious condition that demands attention. But the good news is that with early diagnosis and the right care, it's possible to give your cat a good quality of life for many years. And the first step is learning how to recognize the signs that something might be wrong. Warning signs: what to look out for. Understanding how kidney disease can show up in your cat's behavior is really important because the signs aren't always obvious. Many times, the cat keeps up with their usual routine, but small details can reveal that something isn't quite right. One of the first signs is increased thirst. If you notice your cat drinking water more often or even seeking out different sources around the house, like faucets or flower pots, that could be a sign that the kidneys aren't working as they should. Along with that comes an increase in urination. The litter box may be wetter than usual, and you might notice your cat peeing more frequently or in larger amounts. Another important sign is a loss of appetite. Your cat may start refusing food, even the kind they used to love. And with that, weight loss follows. You might notice they're getting thinner, with less muscle mass, even if they're still eating a little. Frequent vomiting is also common, especially when there's no clear reason, like having eaten something unusual. On top of that, your cat might become quieter, less active, and sleep more than usual. This kind of lethargy is a clear sign that they're not feeling well. One detail that many pet owners miss is bad breath with a strong, ammonia-like smell. This odor is caused by the buildup of toxins in the body, since the kidneys can't eliminate them properly. And finally, dehydration. Your cat's skin may lose elasticity, their gums may feel dry, and they might look more tired or worn out. When these signs appear together or persist over time, they're a clear warning that something is wrong. And the sooner you notice them, the better your chances of giving your cat effective treatment and a more comfortable life. Diagnosis and what to do. If you've noticed some of the signs we've talked about so far, it's time to act responsibly. The first step is to take your cat to the vet. Don't try to guess or treat it on your own. That can be dangerous and might even make things worse. Kidney disease is diagnosed through simple but very important tests. The most common is a blood test, which checks the levels of urea and creatinine, two substances that build up in the body when the kidneys aren't working properly. In addition, the vet may request a urine test to check the urine's concentration, the presence of protein, or even blood, which helps determine the stage of the disease. In some cases, an abdominal ultrasound is also done to visualize the kidneys and detect changes in size, shape, or texture. With this information, the vet can confirm the diagnosis and recommend the best treatment. The earlier the disease is discovered, the better the chances of managing the symptoms and giving your cat a longer, more comfortable life. How to care for a cat with kidney disease. Getting a diagnosis of kidney disease in your cat can be scary, but the good news is that with the right care, many cats live well for years, even with this condition. Treatment will depend on the stage of the disease, but it usually involves changes in diet, hydration management, and regular veterinary checkups. The first step is often switching to a special kidney support diet. These foods are formulated with lower levels of protein and phosphorus, which helps reduce the workload on the kidneys. It's important to understand that even though cats with kidney disease tend to drink more water than usual, as the body tries to compensate for fluid loss through urine, that's not always enough to keep them properly hydrated. That's why it's essential to encourage water intake. Healthy cats, by nature, don't drink much water either, so this is something all cat owners should pay attention to. In both cases, it's worth investing in water fountains, placing multiple water bowls around the house, or offering wet food, like pouches specifically made for cats with kidney disease. In some cases, the vet may prescribe medications to control blood pressure, stimulate appetite, or manage nausea. It's also common to use supplements that help protect the kidneys and balance phosphorus levels in the body. Ongoing monitoring is key. Regular tests help track the progression of the disease and allow the treatment plan to be adjusted as needed. And of course, your love and attention make all the difference. A calm environment, a stable routine, and a stress-free home contribute greatly to your cat's well-being. How to prevent kidney disease in cats. The best way to protect your cat's health is to take preventive steps to reduce the risk of kidney problems. Ensuring proper hydration is essential. Always provide fresh water, and if possible, use fountains that encourage your cat to drink more. Diet also plays a crucial role. Choose high-quality food and include wet options in their routine, like pouches or pâtés, which help keep the kidneys functioning well. Avoid exposing your cat to toxic substances, such as cleaning products, harmful plants, and human medications. And never medicate your cat on your own. Finally, take your pet to the vet regularly for routine checkups, especially if they're a senior cat. Kidney disease is a serious condition, but with attention, care, and veterinary support, it's possible to give your pet a long and high-quality life. Remember, paying attention to your cat's daily behavior is essential. Those small signs that seem harmless might be their way of asking for help. And the sooner you act, the better the chances of successful treatment. If this video helped you in any way, don't forget to leave a like, subscribe to the channel, and turn on the notification bell so you don't miss more content like this. Share it with other cat parents who love their pets and want the best for them. And tell us in the comments, have you ever gone through this with your cat? What was the diagnosis and treatment like? Let's share experiences and learn together. Thanks for watching, and see you in the next video.